week, my best friend, my very best friend this week. Hello, everybody. Welcome on. Welcome on. Sky Houston here with Magic 102. And I'm super excited to have this real candid conversation today with you, with our professionals, with our friends about fibroids. We're going to talk about it today because there are a lot of myths out there, myths that we've told ourselves, myths that have been trickled down from friends and family. But today we get the truth about it. So we have some guests that I want to invite in on today. Our first guest, before I start, I'm sorry, don't be shy today, okay? We're having a candid conversation. And ladies, this is a chance for you to ask the question that you want to know about what's affecting you, what could potentially affect you in your life. Down below, you'll see a chat button where you can send us questions live as we are going through the conversation. If there's something you're hearing and you want clarity on, feel free to drop it below. We'll have our guests directly address that question for you. In the meantime, I'd like to go ahead and get started. Our first guest for today is a wonderful ball of energy. She excites me when she comes on talking passionately about what she's discovered in her studies and in her profession as a doctor with Alate Health. I'd like to bring on the screen really quickly Dr. Manavis. Are you there, Dr. Manavis? Is she there?
Hi
Yeah, there
there.
she is. Hi. Now,
Oh,
Dr. Manavis is a vascular and interventional radiologist over at Alate Health. How are you today, Dr. Manavis?
I'm doing so well. I'm so excited to be here with you all today.
Yes. Well, just give us a little background about yourself and how did you get into the profession?
Sure. So I'm a vascular interventional radiologist. Not a lot of people know what we do. They think we kind of just read x-rays and MRI. But what an interventional radiologist does is we use these images to do surgery. So we do surgery through the blood vessels, making all of our procedures minimally invasive.
Okay, wonderful. Well, glad to have you on today. I'm going to also bring in one of a spokesperson for Alate Health. This woman, when I looked over her videos, just researching her, my mind is blown that she herself has gone through this process. And I'm happy to have her in on today. Ladies and gentlemen, please welcome Sonia Boyd to the conversation on today. Are you there, Sonia?
I am here. Hello, everyone.
Woo-hoo, you look
Hi,
beautiful.
Scott. Thank you very much.
Pleasure to have you on today, and I can't wait to really dig deep into this conversation of fibroids. It's one thing to hear it from a clinical standpoint, but I want to hear the real life testament of how you've experienced it. So we're going to get ready for you, okay?
Okay.
I'd also like to welcome in a young lady by the name of Erica Tart. She is the head of marketing and communications over at Alate Health. Are you there, Erica?
I'm here. Hi.
Yay! Yes. All right. Now, if you guys can see my shirt and Erica's shirt, it
Yes.
says talk about fibroids. And that's exactly what we plan to do today. I almost feel like I've never heard a true conversation about it. Like, now, if I told y'all my age, I know I look good, but I just hit 40 this past year.
hmm
Okay. I just hit 40. And in my 40 years of living, I can't recall ever hearing a real candid conversation about fibroids. But as I mentioned at the beginning of the live, my best friend just had surgery less than 7 days ago. And she doesn't mind me saying it now, but she had a hysterectomy. Now, I still feel young and vibrant, like a young thing, young tender. And to think that that's something that I could experience seeing my best friend go through it, I'm kind of like, whoa, what is this? Why is this? And how can I prevent it? Seeing my best friend go through pain this week. So I want to jump right in and Dr. Manavis ask you the question, what exactly is fibroids?
So fibroids are benign tumors of the uterus. So your uterus is a muscular structure in your pelvis. It does a lot of things for you, including making hormones that make you female. It also carries our babies and it gives all the nutrients to our babies while they're growing. And within this muscular structure, you can grow these tumors that normally don't affect really give you many symptoms, but when they get larger and more troublesome, that's when you can start to really feel their effects and feel that they are present.
hmm
Now, one thing that stood out to me, you said they can grow large. Now, I know our uterus can do amazing things, carry big old 10-pound babies. But I've heard before that it can grow really, really big. The fibroid can grow extremely large. So How large can they grow?
In addition to 10-pound babies, you can grow 10 centimeter, 15 centimeter fibroids. In fact, we just did a couple this week that were 14 to 15 centimeters big. And you're not limited to just one. You can have multiple. You can have a large one, a couple of small ones, then multiple large ones. You know, the combination is endless. So it can really affect the health symptoms.
And I'm only assuming here, I want to totally put it on the record that I know absolutely nothing. So if I ask a dumb question, it's because I'm truly wowed that this is something that can happen in our bodies. I'm more curious, do you feel it? How do you know that there's something going on in your body like that?
Sure. So usually when they're smaller, women don't have symptoms. 7 out of 10 women can develop fibroids. 50% of those women will develop symptomatic fibroids, meaning they're causing enough trouble for you to know that something's wrong down there. So some of the symptoms can include, and Miss Sonia, you can nod along and let me know if you experience prolonged heavy menstrual bleeding, where you just feel that I'm changing my pad or I'm changing my tampon a little more than normal, or if you're talking with your girlfriends and you guys are synced up on your cycle and they're not running to the bathroom as often as you, that's a sign. Painful cramping with your cycle. So, we know that cramping does happen with the cycle when it is debilitating. You can't go to work, you can't get out of bed, and it feels not right. And that's the reason to come in and see us. Feeling pelvic pressure, pelvic pain. And especially when these fibroids get so big, they can push onto your bladder. And when that happens, you'll get all the bladder symptoms. You'll have to go urinate more often. You'll feel that you're not emptying completely. You feel like you have to go more often in the nighttime. And you just feel like you have to go, but sometimes you might not be able to go.
So this is a real serious thing. And I want to also I'm going on the record a lot today. I have a friend, a childhood friend in high school. She was very dramatic about her menstrual cycles. Like she wouldn't go to school. She said she bled a whole month. And I'm like, she is exaggerating. But no, this is a real thing that people experience. And those of us who, are 1 or 2 days, we're like, how is that possible? Thank you for letting me know that my friend was not making this up. She truly could have been experiencing exactly what you said. So thank you again for letting us know when to go seek treatment. Now, is there ever a time when you found that women just do not come till the last moment? Is that?
Oftentimes we do see that because women are I think we kind of like to suffer alone and in silence. So we don't really like to talk about it. So we want to be able to be seen as being able to do everything just like everyone else without limitations. And though I'm 100% for that, if you're feeling like you can't get out of bed because you've got this debilitating abdominal pain, if you've got blood clots the size of oranges coming out of your vagina, then that is a reason for you to tell someone and come in later. A lot of our patients will Google their symptoms, and a lot of our patients have come from the internet, not from their OB-GYN, not from a referral from a friend, but because they're taking time out personally to look on their computer because it's such a private thing and we keep it so private.
Yeah. And I hear Sonia giving a lot of Sonia, tell us a little bit about your story. What was it like for you discovering this? Just take us along the journey for you. When did you discover? Were you self-medicating and at home on Google, like Dr. Panavisha said, trying to self-diagnose? Please tell us about your story.
So I'm going to take you back a little bit further, as she stated with the menstrual cramps. When you're in your teenage years and you're having these cramps, you just think it's normal cramps, just like anyone else. But the bleeding was insane. And I didn't understand. I was a teenager. But as I got older and had children, by the time I was in my early 30s, I was like, okay, I started swelling like Dr. Manvis. My fibroids were the size of a watermelon and cantaloupes, is what I was told.
Wow.
But just because we're Superwoman, you keep going, right? Because you have to work, you have to take care of your husband, you have to take care of your children. You just keep going. But when it got to the point where I was missing work, I had to take several pairs of change of clothing with me because of this. I don't want to gross anyone out because of the bleeding. I would get up from a meeting and my clothing would be soiled or stained. Do you know how embarrassing that is? Talk about your state of mind and your mental health. You're always on edge. You're in pain, and it was constant. And your poor girlfriend was not exaggerating when she was bleeding for a month. Try bleeding for about 45 days straight and having to function. It absolutely depletes you of all your energy. And I did like so many others because I thought it was normal, and I suffered in silence. I did not know my options, and nor did I try to look them up because I was embarrassed to do so. But I am so thankful now that Alate Health is here to provide us with that information, to give us options. Ladies, if I can enforce anything with you, my passion is to help and encourage people. I encourage you to go get tested, go get checked out, go see Dr. Doe, go see Dr. Manavis at Alate Health. It will change your life, and you don't have to go through this alone. You're not alone.
Quick question for you, Sonia, and for you ladies who are watching the live right now, at any time you can go to the website. It's alatehealth.com to get more information on the doctors Sonia just mentioned, to see where they are. Anything you need, they have tons of resources and information on their site. So please take note of that website at any time. But Sonia, you mentioned something very important as a woman who's in a career, raising family. Did you ever find that outside of being embarrassed, was this preventing or hindering anything in your personal relationships, like with the spouse? Did you experience anything in that regard?
You had no energy to be sexual, to be, and I'm a full grown woman, so I enjoy all of that, right? I enjoy the passion, the intimacy, all of it. But when you cannot engage with your spouse, with your loved one, and that kind of passion, it is frustrating. To add, insult to injury, not only now are you bleeding, you're depleted of energy, you can't cook, you can't go out, you can't hang out with your girls. Now you can't have any intimacy. So yes, it was very, very frustrating and embarrassing.
One of the symptoms I left out was pain with sex, dyspareunia, that you can also get with fibroids. Yes, and the fatigue that you felt is perfectly normal, because if you think about it, there's only so much blood in your body. And so if all of this is coming out during a period that's lasting 45 days, a lot of our women become anemic. And so that can also add to the fatigue, this chronic fatigue that you're feeling.
Yeah. Wow. So is it safe to say, if that's one of the things you're experiencing during sex, that pain, you could potentially go to your doctor and get checked out, or would they go to their doctor first, or should they contact Alate for some of these things?
So for most of these symptoms, I would go to an OB-GYN first. See your OB-GYN doctor. And in addition to that, you can also come see us for more specific care. So if someone's diagnosed you with fibroids, then that is what we do. That is our thing. There's many, many reasons why a woman could have pelvic pain, and this is just one of them. So always get checked out if you have a symptom that you feel is not normal.
You know what? I'm grateful, because when I asked the question about going to your doctor first, I realized when you have just your primary care, no one ever talks about these things to watch out for. So I'm going to ask Erica this question as the head of marketing for Alate Health. You guys have really been on the forefront of pushing. Outside of this month being Fibroid Awareness Month, Alate Health is always with the initiative. Could you tell us a little bit about why Alate Health is so on top of it?
Yeah, I mean, like Sonia and of course Dr. Manavis said, we know that women, if the stat is 7 out of 10 women develop fibroids, we know we have to market to every woman, because we don't know what woman could possibly be potentially one that's going to develop fibroids. And especially in our African American community, it hits us about 80%. So I'll let you get into that, but we have to let them know that Alate Health, as we are here to provide a treatment. And more importantly, we just want to let them know their options. Dr. Manavis can probably speak to this a little bit more. A lot of times, they can go to their OBGYN and they may be directed to do one specific treatment. that does not mean that's the only treatment. Let me specify that again. They may be directed to do one type of treatment, but that may not be the only option. We are here to educate, empower, and inspire. So that is part of our marketing strategy. We want the information out there. I am committed in doing that and leading Alate, and we market to every woman that could
I'm
potentially
glad you said that.
a person that is affected with fibroids. And there are many of them. And if you are out there and you are suffering in silence, listen and learn. Please reach out to us. We are here to help and we have solutions for you. Can assure you.
Now I'm bringing all my stuff to the table today. Okay. I already
Please.
mentioned to you guys that my best friend had a hysterectomy this past week. Before that, a couple of years ago, my god sister had a full hysterectomy. And I about keep hearing those two talk about partial hysterectomy, full hysterectomy. I'm like, listen, I need all of my parts. Ladies watching, you may have seen at the bottom of the screen a text scroll by that said 600,000 hysterectomies happen in a year. Dr. Menavise, that's an incredibly large number. Why is that the only option available? Like, isn't there more non-invasive procedures? And why do so many women choose that?
So there are many different options, and I'm glad that we're having this discussion so we can put all the options out on the table. The hysterectomy is the definitive treatment to get rid of fibroids because you completely remove the uterus. If you no longer have a uterus, you cannot develop fibroids. And so a lot of times that is the first thing that you jump to for treatment. A lot of times, depending on how comfortable your doctor is with new technology and new advances in medicine, maybe they'll kind of fall back on a specific treatment more than another. It's really operator dependent and how comfortable they feel with what the treatments are out there. So hysterectomy is, dates back way longer than what we offer, euphy. And, we really have to look at them side by side. In addition to side by side, look at them with the patient and everything that the patient wants from this procedure and what they want, what type of relief they want from their fibroids.
And to Dr. Manavi's point, it's also, like you said, it's also to, what decision they want, because this is their life, right? So a lot of times if you are uneducated or misinformed, and this is where the marketing piece is so important, we want to close that connection and close that gap. So I love the fact that Dr. Manavis mentioned exactly how we do it here at Alate. We look at it with the patient. They need to see the options side by side with the patient, with the analysis that we do in our consultation, which we offer for free. It's important. And that's a very good point.
Can you tell me a little bit more about the UFE procedure, Dr. Manavis?
Sure. So let me just kind of compare the three, give a general synopsis of what else is available. So the hysterectomy is a total removal of the uterus. It's a surgical procedure. You go into the OR, you have a surgical scar across your belly, and your entire uterus is removed. The downtime for that is 1 to 2 months. In addition to that, you have a myomectomy. So that means you're taking out part of the muscles. You're just removing the fibroid itself. That is another surgical procedure. The downtime for that can be 1 to 2 months as well. And what interventional radiology offers and what we offer here at Alate Health is a uterine fibroid embolization. So it's a UFE. And what we do, we take a different approach. Instead of a physical debulking, getting rid of the problem approach, we go through a small artery on the right groin. We put a needle into that artery, and then we'll put dye that will illuminate the arteries in the abdomen. So it's kind of like a highway. And that highway will find the one street that goes to those fibroids. We'll take a catheter and go into the street, and then we'll deposit little particles, they're little circles, little spheres, and we'll cut off the blood supply to the fibroid. If you don't have a blood supply to the fibroid doesn't get its nutrients, it doesn't have any vascularity, and it shrinks on its own and it goes away. And the difference between our downtime is, you don't have a scar. In your right groin, we use a tiny needle. So good luck finding it, especially if I do it. And at most 1 to 2 weeks. The longest I've ever had a patient down for was 2 weeks when she was a little more sensitive to pain. A lot of patients are back to work, up and going within the week. I mean, if you think about it, the women living with fibroids are some of the strongest women I know. You've already gone through so much. So really, this
Right.
procedure that lasts 45 minutes is probably the easiest thing you're going to do that day, because we put you to sleep. So you get a nap for 45 minutes.
Right.
Especially, I know whoever is carrying a whole watermelon around has to be a little tired. So, wow. Now, I'm just curious, Dr. Menavie, with this being COVID-19 times, everyone being quarantined, or just places of businesses being very particular about coming into the office, what are you guys at Alate Health doing to ensure that it's safe and you guys are caring for patients in COVID regard?
Sure. I mean, I agree. It's a very scary time, and we are the safety of our patients, the safety of our staff, the safety of our physicians here is of utmost importance. So we take every precaution to make sure that the spread, even though it's spreading a little bit more in Houston, it's not happening in this office. So our patients are tested for COVID 24 hours prior to coming to the office. Everyone is required to wear a mask. We're not wearing any now because I'm in a room by myself.
I have one. I have our B fibroid free one.
I love it. I love those. They're so cute. And all of our staff are required to wear masks, and we're regularly tested. So even though we haven't, had exposure, and our patients are screened before they step into the office, we still screen ourselves, and both the doctor, nurse, tech, patients, we all wear masks. I know that since our location is near the Texas Medical Center, right outside the Texas Medical Center on Herman Drive, it's a little, scary knowing that you'll be going kind of towards the center of it, but we're outside in an outpatient environment. You're not going to be exposed to, the higher numbers that are currently at major academic institutions right now.
And I can actually say I've visited the office, and it's super clean. It's super welcoming. I laid on a table and I wasn't even there for surgery. It just was so, warm, and just, I felt safe. Let me say that. I felt like I was going to get great care at that office. So I can attest to that. Really quickly.
You didn't say hi to me?
You weren't there that day. I'm sorry.
And I'm just going to add one more quick question, and I know we have some questions in the chat, but I'm going to add one more quick point to Dr. Menavie's statement. Another option is because we are so focused on patient care, we don't want to leave any potential patient behind. We do have televisits. So at the end of the day, if they request a televisit consultation, we can make that happen. Whatever is in the best interest and safe care of that patient's preference, we will find a way to make a way to see them and consult with them as safely as they feel.
Wonderful. And again, ladies and gentlemen, on their website, you can see how to get one of those consultations, alatehealth.com. Okay. So let's jump into some of the questions we have in the chat. I have a few here from our social media, and whomever, feel free to answer. Okay. So the first one is, how do I talk to my partner about the effects of fibroids and having sex? Because at times fibroids make my partner uncomfortable, but how do I have that conversation? And can my partner come with me to a consultation?
That's Sonia and Dr. Menavie's question.
Yeah. So my conversation was, quite candid. When you have someone that you love and they love you and they see you in pain, and they don't know how to help you, they don't know what's going on. At the time that I was experiencing my fibroids, we had to kind of research and find out what this pain really was, and we did that together. And so you have to be honest. I would kind of hide. I got to admit, at first I was, like I said, I was embarrassed, so I would try to hide myself or hide what was going on, but he could eventually see what was happening. And when I did finally have the conversation, I was boohoo crying. I was all over the place because I was like, I didn't understand why this was happening to me. But once I actually sat down and we sat down and I explained, this is painful. I love you. I want to be with you. I don't want to feel this way, but this is where I am. This pain that I'm experiencing is unlike anything else I have ever experienced. And I want you to understand that this is not anything that you're doing to me to hurt me. This is not anything I'm doing to hurt myself, but this has to be addressed. And I would like for you to come to the doctor with me as we address it so that you can understand why my stomach is swelling, why I'm absolutely exhausted, why I can't cook, why I can't go out, why I can't do any of those things, and why I feel so embarrassed and ashamed. And of course, he reassured me that, he was there to support me. So I would tell women, please just be as candid as possible, as transparent as possible, and don't be embarrassed. Don't be ashamed. It is not your fault. It is nothing you could have done. We really don't know how or where. I didn't at the time, how or where it comes from. There have been things out there that they say about, hair relaxers being a cause of it, foods you eat, genetically disposed to fibroids, whatever it is. Have that conversation with your spouse and let them know that you need their support and you need them to understand as you go through this process.
Yeah. I'm glad you said that because I got emotional. I'm not even about to have the conversation, but my body felt heavy at the thought of having that conversation. Does Alate Health, perhaps, when someone is coming with an issue like this, is there something that, like, to support them mentally? Do you guys have some type of counseling that maybe, or did you need counseling afterwards, after your situation?
I'll be honest, I sought counseling secretly for that and a number of things, but because there's such a stigma in the Black community about counseling at the time, I was like, I need to do something. I have to get some help. I'm about to lose it mentally. I was about to lose it. And I was very unstable because you plan your life. You do all the things that you're supposed to do. You go to school, you go to college, you get married, you have the 2.5 kids. How is this happening to me? Why is this happening to me? And you're afraid to really share it with anyone else. And especially if you're at work and you have what I call an episode of bleeding, and you get up from a board meeting, in which what happened to me, and my skirt was soiled. And I'm thinking I'm cute and I'm walking and I get up and some lady tapped me on my shoulder. She said, "Ma'am, I hate to tell you this." And she's whispering and she put her coat around me. And I had to walk out of that boardroom with that coat around my waist because my skirt was soiled. So yeah, it has some mental effects on you. It really does. And again, that's why I tell people all the time, do not be afraid to seek the medical help you need, nor be afraid to seek the mental help that you need. It will get you through it. I promise you it will.
I think when we don't provide, actual professional counseling here, but we see so many fibroids and we talk to so many women that suffer with fibroids very candidly because it's just, the woman and I in a room just and so the relief that I see on their faces when I nod and I say, well, how big are the blood clots? Are they dime size, orange size? How big are they? And they're like, oh, she knows, or
Right.
wearing tampons and also a pad underneath to make sure you don't have an accident. And they look at you and they're like, yeah, she gets it. So, not professional counseling, but just to have someone to support you and understand where you're coming from and to let you know that there's not anything wrong with you. This is the pathogenesis. This is the disease process that's causing this. And instead of kind of dwelling on that, we're just looking towards the future. How are we going to fix this?
Right.
I have another question from social media that asks, can fibroids turn into cancer?
So fibroids, their definition is that they're benign neoplasms, so they are by definition non-cancerous. Less than 1% of fibroids can turn into a leiomyosarcoma, and that is cancerous. So the things that we do to prevent us from embolizing something that is cancerous and should be looked at by an oncologist or a gynecologist. We put an MRI before of the pelvis so we can look at the fibroid, see the shape, see the size, see how it picks up the dye, and all of these characteristics can tell us if it's a scary thing or if it's just a normal run-of-the-mill fibroid. If a woman is older, then we'll have more suspicion of, or we'll be more on the lookout of, one of these fibroids transforming into something malignant. But again, less than 1%. And on top of that, if we were to really be suspicious of one, you'd get a biopsy before. So really, we have a lot of precautions to avoid embolizing something that should not be embolized. But the chances of this are so low. So low.
Now, I'm laughing, Dr. Manavis, because the thought came in my mind when you said if a woman is older, I told you I just turned 40. What technically is considered older? Let's ask that question.
High definition. So if a woman's over 50, then we'll pay a little more attention to the characteristics of their MRI, and that's it.
All right, so another question. Another question from social media.
One thing is, we talked about the part with the patients when they come in for support. I, as the marketing person, I listen to a lot of our consultations at times, but mostly when they first call in. And to be honest with you, we get quite a good percentage of men do call. They immediately call. Absolutely, they do. They have listened to our Majic commercial and they have said they've been in the car and they know the symptoms that their wife has experienced. They may call and say something to the effect of, "Oh, my wife, I heard your ad and my wife has been complaining. She's in pain. And she's went to such and such, but we want more options. And we heard the commercial." So we do have quite a good amount actually of men that call on behalf of their significant other or spouse looking for a solution, and they do come in to the office as well. So that is a good thing, guys. So if you're here, you're tuning in, take care of your significant other and your spouse. If you know they're suffering in silence or they need additional support, please reach out to us. We are free to take your calls as well.
Thank you for saying that, Erica, because before the live, I went on extra early and told the guys to feel free to come over. So thank you for telling them that.
No problem. Inclusion, of course.
Dr. Manavis, were you about to say something?
I was. The amount of conversations that I've had with boyfriends, fiancés, husbands, on speakerphone, she'll be in the office with me, but her significant other will be on the phone. So I'll explain it in a way that she understands, and then I'll explain it in a way that he'll understand, so that everyone's on the same page about, fibroids and what we can do to treat them.
I love that, because Sonia mentioned something so important. A lot of times males don't know how they can help, and they want to solve it for their loved one, and they feel helpless. So this is a way to help empower them as well, by giving them the resource to say, you can call, you can get the information, you can support in this manner. So thank you guys for that. Another question from social media that I got is, could fibroids come back after treatment?
So I can't really speak to the other myomectomy because I'm not an OB-GYN, but with the uterine fibroid embolization procedure, there was a study that was done, and they followed up the patients in 3 years, and after 3 years, 14% recurred, and so they had to do the procedure again. This doesn't mean that another fibroid in another area that I did not treat won't pop up. So this is 14% in the fibroid that I touched, that I embolized. And when you think about the procedure and what you really have to go through, it's a little poke in your groin and you're asleep during it. It's, around 45 minutes. It's not that much of a process when asked to do, if it comes back, and the percentage is so low, 14%, that it's a small price to pay, I think, to still be fibroid free and symptom free. 90% of the patients have satisfaction in their reduction of symptoms. We can reduce the bulk symptoms, like the bigness of the fibroid, 50 to 80%. So, once every 3 years for 90% symptom relief, I think we're A-okay.
Okay, and you're right, for the price to pay, I would come see about it. Speaking of price, do some people insurance cover this? Can you use your insurance for this?
Absolutely. We take Medicare, Medicaid. We will work with insurance companies. I don't think there's a single insurance company we haven't come across, right, Erica?
We have those our the insurance that we accept. We list them on our website. We have them call because we also offer options as far as payment plans. I think we're one of the few that would offer that. So we want to help. That's the number one thing. We have the solution if it aligns with that patient care. And we want to plan it out so that even if it's not covered under insurance, we have options internally, in-house at Alate to help them achieve that goal to be fibroid free.
Nice. One more question from social media. The question is, do you guys know of any support groups for women living with fibroids?
Yes.
And maybe Sonia, you too can chime in with that one.
Well, there are some out there. To be honest with you, I can't recall because, like I said, I went to counseling. And before I did that, I did attend a actual support group, but it was for women that were suffering in silence about things that were affecting their body and not just fibroids. But I understand that they are out there now, which I am so happy to hear about. So yes, you can Google it. And Dr. Manavisa, Erica may know a little bit more about that, but there are groups out there for fibroid support.
Was there someone else?
I was going to say that when you come in, if we have a consultation and that's something that is brought to our attention, we do take aside and look up information as I will for the patient as far as organizations that could possibly or potentially help. But any type of woman relief group, there are some women relief group, not just related to fibroids or women suffering from fibroids, but overall mental health, because as Sonia stated, there's a direct link or comparison for someone suffering with fibroids. That's a mental aspect to that as well. So we probably pretty much direct them in that aspect and then go from there.
All right. Now, quickly, guys, if you're watching on social media, you know you can follow Alate Health on their Facebook pages, their Instagram pages, or go to the website. When you go there, they're giving away some goodies. I was trying to keep them for myself, but we have care packages that we would love to connect and get to you, which includes the shirt that I'm wearing, the talking about fibroids. It has the Be Fibroid Free mask and some other goodies in it. So if you go to their social media pages, you could register for your chance to get one of these good sacks. I may try to keep this one, but if you would love this pack, make sure you add us there, go follow their pages and get the information there. Erica, anything else they can do to get it?
Just pretty much follow us on Alate Health Instagram page. We like to engage on Instagram. Dr. Manavis, as you can see, she's a bubble of energy. Even Dr. Joe, and you guys will see him a little bit later. But trust me, it's we want to talk about fibroids. That's our hashtag. Hashtag talk about fibroids. We use that platform to do so. So if we can hear from you or you're a first-time follower, you have a chance to win one of our care packages personally, and then I will reach out to you. So please engage us, women. Again, we want you to talk about fibroids, and we want to spread the information that will educate, empower, and inspire you to be fibroid free.
And we want to keep the conversation going, you guys. So if you have more questions, even after the live, feel free to send it below to me, and I'll get it over to the team there at Alate Health. Again, don't be afraid to reach out to them directly. Go to their website. And Erica mentioned Dr. Doe. Before we go, we're going to hear from Dr. Doe. So if you hold tight, we're going to see him now on the video. Thank you, guys. Dr. Manavis, thank you. Sonia, thank you so much.
Thank you. And I know questions, I'll say that in the chat. I'll be trying to respond to as many questions as I can. But if your question did not get answered, please, again, go to our website, call our office, connect on Instagram, but we will be in contact with you. I can promise you that.
All right. I feel like we can go on and on about this. I have so many more questions. Yes. But thank you all.
Thank you.
Hello, I'm Dr. Andrew Doe, founder of Alate Health. I'd like to thank you for tuning in today to talk about fibroids. I'd also encourage you to make an appointment with our office with myself or Dr. Manavis. And I'd like to leave you with one fact about fibroids. up to 7 out of 10 women suffer with fibroid disease.
Big number. 7 out of 10. And 80% of African American women. Ladies, if you are tuned in and you are in any of those categories, the big out of 7 or 8, 80%, then pay attention to your body. Don't be afraid to get more information. Contact our friends at Alate Health. They're here for you today. We thank you for tuning in to talk about Fibroids Live with me, Sky Houston, and Majic 102. You guys be safe and be healthy above all.
Thank
Y'all
you.
have a good day.
Bye-bye. Be safe.
Bye, everyone. Thank you.
Bye-bye.